we wanted to meet you from before to talk about the real pictures of these dengue outbreaks in Nagaland. But most of the officials from the directorate went to Delhi for a meeting with the Ministry of Health and Family Welfare officials at New Delhi, and we just came back recently, so we could meet you and invite you only today. So regarding the dengue outbreak, the first dengue outbreak in the state was detected in Dimapur district from Mishikido village on 15 June 2023. And there was 2 laboratory confirmed cases from Sentinel Surveillance Laboratory in Dimapur. So immediately on the same day, the entomological team acted swiftly and conducted a comprehensive survey on the same day, which confirmed the presence of dengue outbreaks, dengue vectors. So subsequently, the thorough case investigation was carried out from the same day. So now my officials are also here, Dr. Vezekulud and Mirenla, Dr. Nyan and Dinurenla, so they can come in and they can also come and join us in this discussion. Yeah.
So thank you very much, sir. So like yes, for 2024, 25, and 25 and 26. So we were all parked in Delhi for the last 1 week, and we could only call you today, and we would like to thank you for your prompt response. And just to give you a picture about what has been happening in the state of Nagaland. So like how our sir has said, the first laboratory confirmed test and positive case of dengue was found on 15th of June in Dimapur. Since then, the district teams led by the Vector-Borne Disease Control Program, they have been actively carrying out case investigation, entomological surveys, and also this source reduction campaigns and house-to-house visits to reduce the source of the vectors, and also creating awareness. And also we have been publishing a lot of media snippets on all the different social media platforms, and especially focusing on the educational part of the control of the vector. So we have been carrying out all these activities, and as you all know, this dengue has a cyclical pattern of having increase in the number of cases. The last time that our state, so this dengue issue and the number of cases which are increasing is not only in our state but all over the country, and this can be attributed to many factors. One is rapid urbanization also, and also the very conducive environment which also facilitates the growth of the vectors. So like the recent climate changes, the floods which has happened in Dimapur and also in the low-lying areas of the state. This has also brought about the spread of the dengue virus all across the state. First, it was mainly focused in the district of Dimapur, but slowly it started spreading to the other parts of the state. And as of now, we have detected the dengue cases in all the districts of Nagaland except for Noklak. So till last week also we had no cases in the district of Tuensang also. But right now at the present moment, out of the 16 districts, 15 are dengue. And so this is the situation at the moment. And one thing which is on a positive note is that we know that there are various types of dengue. So we have the normal one, which is the dengue fever, and then we have the dengue hemorrhagic fever also. So the dengue hemorrhagic fever is the more virulent type. So as per the records with us in the Directorate of Health and Family Welfare, we are not seeing the virulent type because we are correlating it to the clinically. And if we correlate the clinically, the dengue hemorrhagic fever, we are not seeing the more virulent type of dengue. So this is a short overview of what is happening in the state with respect to the dengue virus. And 9. And 9.
This is a confirmed cases, yeah.
And according to GOI, the government of India, they don't accept dengue test if it's positive through rapid test, because there's lots of false positive in RDT test. So even if we get positive in RDT, this rapid test, we have to do confirmatory test through ELISA. So we have 2 sentinel sites, one in Kohima, one in Dimapur, the district hospital Dimapur, and H&Fw Kohima. And recently, just a few days back, we have started in Kansam also. So as per our vector-borne program, we have to report only positive cases which are confirmed through ELISA test. So through ELISA test, confirmed cases are 2,909.
They get reinfected. Yeah, that is possible. That is possible. No? Because if you get infected again, you get cured. I mean, there is no specific cure for it. It's just the supportive treatment. But then again, after 2-3 weeks, you can get reinfection again. No? So that's why the focus is on prevention. So the prevention is basically personal prevention also, and also the community also. How to keep our surroundings clean, and source reduction basically means to remove any stagnant water, even 10 ml or 50 ml of your water. If it's stagnant, it can be a reservoir for the dengue mosquito to go and lay the eggs. Yeah, so that's why we are also emphasizing a lot on source reduction. So unless we reduce the source, the dengue mosquito will keep on coming out. So that's why we have also been conducting a lot of awareness, and we want the community participation also, because we cannot go to each and every house, and in that manner we want the people to come forward also, and to also keep their surroundings clean.
Lesser this.
So this, yeah.
This actually is, it's a viral disease, this dengue. No, it's through the mosquito bite, it's through the vector, that is a virus. So lots of false positive cases comes out through RDT. Before, when we didn't have this RDT, many of the doctors, clinicians also just diagnosed it as viral fever. Right? But with this RDT, like, they don't allow us to show that it's a confirmatory test. Unless we do the ELISA test, they don't accept it as dengue.
So the relevant question, I'll share with you later on. No? The data. We have the data from 2005 till 26th of October 2023. So there has been a cyclical pattern where the number of increase in the number of dengue cases have been found. So in the year 2016, we had 139 positive cases. Then in the year 2017, it was 357 cases. Then it went up to 374 cases in the year 2018. But in the year 2019, it went down to 6. Then in 2020, it went down to 1. Then 21, it was 24. Then in the year 2022, it was 154. So this pattern, it was quite similar with the rest of the country. So now at the present moment, we have 2,909 as per the latest thing. So till 26th of October. So this data I will share it with you if you want. No? So cyclical pattern is there, and we are experiencing that all over the country due to various factors.
This is Dimapur has the highest number of cases, but the crime is over one because one is far away and it doesn't have facilities as such, hospitals as such. So what is the department doing, or how is the department handling cases in Dimapur? And what is the number of cases in Dimapur?
For month, we all know that dengue month is July to September, so we are aware of it, and we have a district task force in place under vector-borne, and we had several consultative meetings also, and here we have been the coordination is there, and for district Mon, on the first case, RDP positive was detected on 4th July. Then we started having our advocacies, and we have set up a control room to look into the trend, the monitoring, the trend of the incidence of dengue, then distribution and spread, and emergent programs. So that we decided in the DPS meeting. We had a consultative meeting with our medical minister also on August 1st to plan out the activities for the prevention and control of dengue. For District 1, District Hospital is set up. We have all these testing facilities also. So like at present, of the 2,762 tests, RDP tests positive, we had sent samples to sentinel surveillance site in Dimapur for confirmatory tests, of which 835 are confirmed by ELISA test. So we also have that, knowing that there's an outbreak of dengue, we have our contingency plans also in place, and advocacies in the form of IC we are given in local dialect. We have our civil society organizations and our stakeholders coming, and with Deputy Commissioner as our chairman, we have done our consultative meeting, and these are carried out. We went for advocacy so that this to improve the early diagnosis of dengue, and also to reach out to people who seldom come for clinical services. So testing also has been done, and we know that for dengue everything is prevention and control, and for the treatment part is symptomatic. So like at the initial, after the first case was reported, confirmed case on 28 July, people started coming for early diagnosis, and they've been treated and they've been discharged. So that's it about the Mon district. Former MS officer is here.
I can also highlight, as our CMO has already highlighted, it was first detected in the month of July. Then the cases started increasing from the first week of August. And as you all know, why it's more noticeable in Mon is because of the health facilities. District hospital is catering to, and Mon district is one of the biggest district in Nagaland, so it has a third highest population also. Then health centers, only the DH is there. For Kohima, Dimapur, we have so many private centers. But for the whole district of Mon, the referral center for the whole district is Mon DH only. And Moon DH, as we all know, the manpower capacity is only for the bed strength of 50, though it has been upgraded to 100 bedded. And seeing from the number of patients, we were having at the maximum 131 patients also. So that bed strength we could increase because we had some bed supply from the department also. The department helped us also by providing us some beds. Then with regard to HR also, we had a huge problem. It was a big crisis. And you know, in government setup, we just cannot appoint doctors, nurses like that. So we had to do our own adjustments. So with the help of our CMO, we did some exercise within the district only. So she pulled out some nurses from some health units, from the district health units. And on a rotation basis, 5 nurses per month, she had done a rotation. We'd done an exercise. The routine was out up till the month of December. And with that, we were running the show, you can say, because in maximum, we need nursing care. And we had made a small video also. I don't know, it didn't went viral, showing the patients, how the patients were there. Like, we had the district hospital. It was fortunate for us. It was a big hospital, and it's a 3-story hospital. So we had some extra rooms also. Big corridors were there. So we had converted, and we have converted our conference hall into another ward also. So with that, we could put the bed capacity. We could increase the bed capacity up till 150. So with that, then our minister also came on 21st August. So we had a consultative meeting. Then some extra manpowers were sent from the other districts, from the MMU teams of all the districts, like from the nearby districts like Longling, Mukokchung. Then from Kohima also they came. Then from Zenapoto also they came. A big team came of 4 medical officers, 10 nurses, some 8 lab technicians like that. And we pulled out some lab technicians from the district also. Then we pulled out some 3 MOs from the district also. So altogether, actually the MO strength in district hospital is excluding the dental doctors and the Ayush doctors, and excluding myself, though I'm the MS, I'm looking mostly after the administrative, it's only about 8 or 9. So we got some extra manpower from the district also, 3 manpower, 3 MOs, then 4 MOs from the other district. So that's how we were running the show. So with the department also helped us a lot. Then medicines also, they sent us in surplus, especially IV fluids only we needed, then paracetamol infusion. Then from the PMJY, Ayushman Bharat, the hospital also procured some medicines also, so we could give it freely to the patients. Then since for the diagnostic part, the state cannot procure the RDT kits, so from the hospital funds only, we procured the RDT kits. So we did all the testing also. Then the platelet counts, all the basic tests were basically done. Only a small user fee was done. For the RTT test also, we were charging only 200 rupees, whereas in the private setup, they were charging 500 rupees. So at the district level and at the from the state level also, we got enough support. So up till now, like we could run it like that smoothly without any hiccups. Anyway, the patients also, mostly because of all the smallest complaint, because of the increased health-seeking behavior for the smallest fever, were all coming to the hospital only. So if we admitted like around 32 patients today, equal amount we are discharging the next day or after 2 or 3 days like that. And as such, not much serious cases were there also. We had the first death, that was in September 23, but the patient had other problems also. He was a cardiac patient, and just he was tested dengue positive, and for confirmatory also he was positive, but he had other comorbidities. So those patients were coming, those without any other comorbidities like diabetes or hypertension. I mean, like, they used to get well within 2 or 3 days, and we used to discharge them. And from the medical point of view, or from the health, from the hospital management and all these things, like enough manpower and then medicines were there, so somehow we could manage it. Then whenever we used to have this DTF meeting with the civil societies and all, one most important thing was about this source reduction. So this source reduction, it's with the public only, it's with the community only. And so for that also we had some meeting with the district authority also, so they had encouraged to go for cleanliness drive, and every Saturday they decided to have a social work so that they could clean their surroundings and their colonies.
Yeah, so here, like we all know, there has been a lot of demand for blood platelets. So one thing positive that has come out of this is the awareness for blood donation. Last year, we know that as per the records of the blood donation, the records and the drives, which some of you are also members, I think all of you also. So here, till now, till September 17th, we have so far collected 12,701. The blood donation has happened. So a lot of people have also voluntarily come forward, and there has been a lot of awareness, and plus the people are also now, all the myths and misconceptions related with blood donation is, we feel that this is one of the positive outcome. So blood separator, like you said, we have it in Dimapur. So that is, you're taking the major chunk of the cases. And also, if we have to talk about, there are so many initiatives which has been taken, not for one particular district, but it's for the whole of the state. So right from the beginning, right from the highest level of the Department of Health and Family Welfare, there have been hands-on field visits were taken off right from the top, right from our Honorable Minister, our Commissioner Secretary, our Principal Director, our Mission Directors. So all of them have been hands-on right from the beginning. They have visited, in fact, our Honorable Minister had gone down to Dimapur. He had visited the Dimapur District Hospital. Then there was one time some talk in the media that, not in the media but in the social media, that we are going to get overcrowded with beds, with patients, and beds will not be enough. So our Honorable Minister, along with our senior officers like our director and all, they had gone down to Dimapur, they had inspected the referral hospital, they had even gone to the Chumukurima Police Referral Hospital to find out, to take stock of the necessary preparedness, in case a surge do happen. But as per the records, because we have formed, respective districts have formed the Dengue Response Team that has been formed in Dimapur, in Mon, and in the other districts also, which is headed by the Deputy Commissioner and with the CMO and the Medical Superintendent, and plus the other departments also. Then at the state also we have the state task force. So these are being monitored on a daily basis. In the directorate also we have the emergency dengue task force, where a senior director is monitoring on a daily basis. On a daily basis, all the reports from the districts come, we analyze it, and as per the analysis so far, there has, after that surge at one time, we are seeing a plateau in the number of positive cases and also in the number of admissions. And by God's grace, no deaths have been reported so far due to dengue, except for that one which Madam has already highlighted.
In addition to what Dr. Nyang stated, we have this state Dengue Response Team is also there. And it is headed by the Honorable Minister, Health and Family Welfare. And the department is monitoring the situation closely. And what I feel is that the situation is under control. Yeah, so there is no need to panic.
One of our CBC, we were running with only one complete blood count machine. And for dengue patients, very important to know their platelet count. So our Honorable Minister, knowing the need of it, he has donated one CBC machine also in the month of September.
CBC stands for?
Complete blood count.
So our higher-ups have been hands-on.
Yeah,
so it's a
hands-on.
hands-on approach. So at the back end, we're also there, and then the healthcare workers at the field, 24/7, you're on the job. Both our madams, they had just recently come back from Mon. So, like how they have explained, they were in the field.
Yeah.
And
All of us were on the field only.
Yes.
From the office, I'll tell her, so I need some manpower, so you please arrange. So she'll arrange. Then she'll come down to the hospital also, look at the patients, how to go about like that. So it was full hands-on.
For district Mon, it is, the population is a big population and very far remote. That's what we always call. But the implementation plan of program, whatever is happening in the district only. And for even the community participation is good, because here we see our stakeholders, our partners for social work.
Yeah.
And contribution from their side is also very good. Then we have our Konyak Baptist Church Council, who have donated 5 lakhs. 2 lakhs for the district hospital and 1 lakh for the private hospital for free
Diagnosis.
And we also had our
And those
legislators
also
they
donated
donated
1 lakh.
for 4 patients' welfare. And our medical minister, he was the first one to donate 2 lakhs for the district hospital, and also the CBC machine, which was in need. Of course, the CBC machine was there, but because of the high caseload, that additional had come in. So likewise, from the community side also, they have done, and also from our side also, from the medical department side also, we have brought in the paramedical workers to district hospital with work distribution. Then the manpower as from the outpost, nurses were brought in, medical officers were brought in, then lab technicians were brought in from. So there was the manpower, the functioning is up to date, and there was no gap in that, I think. And from the department side, they have sent an entomology team also. That was in the month of September.
August. Right after the minister's visit.
Yeah. So like two species were identified, that is Aedes aegypti and Albopictus. That was identified also. And with that we went for source reduction to that artificial containers and all to be emptied. The team, the vector-borne team, we have surveillance workers, we have MTS, we have malaria inspectors. They were doing the work, giving awareness, doing all the source reduction also. So whatever implementation plan was there for the program, it's been ongoing. It's ongoing.
Just to supplement, madam, actually regarding this dengue, there is no cure for dengue as such. It's just a symptomatic treatment. Source reduction is very important. So what we found out is when we went searching house to house, especially Nagaland side, it's still happening again and again. Though fogging keeps happening, still that dengue cases kept rising. So they went again and again for a household survey. So we found out that even though we give education to the public, especially regarding the bottles, discarded bottles and tires and all those small containers and all, they used to find the same thing again and again in the same house. Like, even though we give education, so in awareness, if you learn something about this awareness, prevention, source reduction, because prevention is the only cure, that's what we can say. Source reduction, and it's not the medical people who has to go and throw their water and whatever containers they have. So that if you can just write about it, that source reduction is the only way that we can do. And the larva, the mosquito from laying the eggs, and the larva developing and developing the mosquito. So source reduction, keeping the surroundings clean.
So here, the public has also been really cooperating there. But what we want from the public is to do it on a regular basis. They have been also really cooperating with us, and they have been also doing a lot of removing the stagnant waters and all that. But one thing is we need to do it on a regular basis. So just to intensify our actions. So through your platform, we want to appeal to the public also that to do it at least once in a week. Just a one-time thing will not be happen. Because the water will collect again, so we have to empty it out also. So to do it regularly, like how Madam was also saying, like that.
It's hoping and on regular basis.
July 31, through its office memorandum, has issued an order for the medical doctors evading non-practicing allowances and then working in private hospital and then their own clinics, giving them a 1 month time for them to discontinue on that. How many doctors have reported it have discontinued, and then what is the status of that?
Actually, exact number we cannot tell you, but after the government issued that notice, majority of the doctors are reluctant to go for private practice also. That is what I feel.
What cases What cases
So this is under the consideration of our governor, of our government. So, so it is still under consideration. So I think it would not be so wise for us to
comment.
Comment.
Setting up CCTV in all the pharmacies in Nagaland, like as well in other districts. Like the reports and all, rather visited, I come across many of the pharmacies has already set up the CCTV. But like what I'm like just want to know is their report that has been reported in the CCTV. How the department is going to use these things, the proposal of setting up the CCTV.
Okay. So I think this is not report. Okay.
Yeah.
So basically we have the drug control division. So drug control the administration is there. So we are not dealing with the pharmacy issuing the license or the enforcement part of all this CCTV kind of thing. So I think we can always, I can get back to you, I can ask the drug, the controller,
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.